This course is to be used for educational and awareness purposes only, is open to all, and is free of charge. In this lesson, you will learn how to protect yourself and the people around you from COVID-19. By the end of this lesson, you will learn about the basic preventive measures to take during the COVID-19 pandemic, understand the importance of following hand and respiratory hygiene, learn about the best practices for following hand and respiratory hygiene, understand the importance of following social distancing, identify the best practices for social distancing. First, let us learn about the basic precautions to take during the COVID-19 pandemic.
Novel coronavirus or COVID-19 disease can be stopped. Together, we can do it. All we need to do is take basic precautions. Whenever you cough or sneeze, always cover your mouth with a handkerchief or tissue. Throw the used tissues into a closed dustbin immediately. Don't touch your eyes, nose, and mouth unnecessarily. Wash your hands with soap more frequently and for at least 20 seconds. Avoid participating in large gatherings. If you have a cough, fever, or difficulty in breathing, avoid close contact with anyone. Visit the nearest health facility or your doctor immediately if you have symptoms. Cover your mouth and nose using a mask or cloth at this time.
Now, let us learn about the importance of maintaining proper hand hygiene and its best practices.
It's important to remember that healthcare providers aren't the only ones who need to practice hand hygiene. Patients and visitors should also wash their hands very often, especially after touching surfaces in the patient's room, before eating, and after using the restroom.
Now, let us learn the etiquettes and best practices for coughing and sneezing in public.
First, observe social distancing of an arm length. Use handkerchief or a tissue paper to cover your mouth so that droplets does not reach the people around you. If you do not have a handkerchief or tissue, use your upper sleeve or inner aspect of elbow to cough or sneeze. If you use your bare hands to cover your mouth while coughing or sneezing, wash your hands with soap and water. The right cough and sneeze etiquettes will prevent spreading of any form of aerosol into the air or the environment around you.
Now, let us learn about the importance of correctly using masks during the COVID-19 pandemic.
This is how you should wear a mask. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Verify which side is the top. This is where the metal piece is. Then identify the inside of the mask, which is usually the white side. Then fit the mask on your face. Pinch the metal strip or stiff edge so it holds to the shape of your nose. Adjust the mask over your face, covering your mouth and chin, making sure there are no gaps between your face and the mask. Do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard the mask immediately in a closed bin and clean your hands. It is important not to reuse a mask. Replace it with a new one as soon as it gets damp. And remember, the best way to protect yourself from the new coronavirus is frequently cleaning your hands with alcohol-based hand rub or soap and water. Stay safe and see you next time.
Finally, let us understand what is social distancing and why is it important during the COVID-19 pandemic.
Politicians, scientists, and even celebrities all want us to practice social distancing. It means no coming into contact with people unless you need to. So no more visitors at your house, visiting other people's houses, going to restaurants, parties, pubs, clubs, sporting events. You get the idea. If you can work from home, the government says you should, and your employer should help you do this. If you absolutely can't work from home, then avoid busy travel times. You can go out for a walk and buy essentials, but you need to stay at least 2 meters from everyone else. Imagine you're holding a big broom. You'll be the correct distance away if you can't touch anyone with it. Now, the people who need to practice social distancing the most are the over 70s, anyone with an underlying health condition, and pregnant women. But really, everyone should do it to stop the virus from spreading and reduce the pressure on health services. Because if you limit the contact you have with others, you're reducing your chances of catching the virus and passing it on to someone else.